Hey guys, welcome to my new video of Talk to Me. So today we are here with the second part of the depression video which we had shooted last week. So as we know that clinical depression nowadays it has become like an epidemic. So today I am here with Bhaskar sir, who will explain you what is clinical depression and what causes it and how we can overcome it. Sir, what is clinical depression?
So first I again thank you for this endeavor and calling me here. So this is nothing but the extension of this last video. So we are just extending that this clinical and normal depression part. It has been estimated that in depression and all types of psychological turmoil, so there is a neurological survey in India, and maximum percentage of this Indian, those are suffering from this depression, and it has been found that during this lockdown 875 people has committed suicide. In Ludhiana 100 people committed suicide. In Nepal as 875 people suicide. So every day more or less 5.5 as the average. So clinical depression is not just a clinical condition, but it is a kind of an epidemic, and it is a psychological epidemic. So today my intention is that not deliver the bookish things. I have read a lot of psychological books, and it is going too much clinical towards the medication and psychiatrist. So our intention is that today just touch the surface and the rim of these things, and today we are also interested to understand the superficial and bird's eye view of this particular you can say is a disease, a trauma. Doctors normally cover this total rim under a psychological turmoil because it is some kind of an imbalance in the psychological waves. So the entire video will be based on our experiences, our visionaries, not just bookish or just mere clinical. So if we just define the clinical depression, just we know the meaning of the clinic. So whenever we think of a clinic, some normal things strike on our brain, that the clinic may be the filled with the doctors, nurses, medication, therapies and drugs, injections, so many things. So that is to some extent it is perfect, but clinical depression is it has a little bit deeper meaning. So if I think of a x and y axis, you draw one mentally, you draw x and y axis. Now you take the 0, 0 point. When you are going upward in the y direction, it is a kind of a mania, and if you are going downwards in the negative y axis, we call them as a depression. Now in case of a normal graphical like a presentation, as we have discussed in the last video, in normal case it is like a AC current, so it fluctuates. But if a person is suffering from like a bipolar disorder or unipolar disorder, so you can see the graph is going up and suddenly it is going down, so it is towards the depression. But if it is a bipolar, then there is a fluctuation from mania to depression like this. So if it is a highly oscillating up and down towards the mania to depression, that is called the bipolar disorder. We can only tag it with a clinical this word when it is going more than 2 weeks. And it is also evident that 20% of the women in the country and overall, and women are more prone to this clinical depression than male, that is only 12%. So irrespective to the gender, we will make it a common problem. So now today we will discuss the things in a deeper way, and we will try to find out the reason behind it.
Okay sir, so I would like to ask, what are the reasons behind this clinical depression?
Achha, now we know the definition of it, and we have to understand the reason behind it is very not clear, because it is a multifactorial trait. If you go for the details, it could be your genetic, it could be you could have some neurological chemical disbalance in the brain, society. So as I am saying, it's a multifactorial trait, so there is a high possibility the multiple factors are there. It could be society, it could be your thought, the environment where we are growing. So each and every person have a certain type of a psychological level of thinking. So if that particular society is suitable for that person, that is very question. You can make a question out of it. So that multifactorial trait, as we know, there is no specific reason behind it, but the reason that has been responsible for this particular psychological turmoil, they are saying it could be your past life experience. Many of the clinically terminal ill patients, psychologically stressed, so they are feeling a certain type of guilt in their life, and they feel themselves as a worthless. So this is a mental design that is mainly caused by his the way of thinking. Now this question will go deeper because still we do not know what is the nature of our mind and consciousness. There is a therapy that if you cut some part of your brain, like a dissection or the tummy of the brain, so the pupil, this is a kind of a repair. So they actually retract from that situation. So that is the one main reason कि our genetic factors are there, definitely clinical factors are there, and the environmental factors are also there. Past life experiences, some like death of your near and dear one. So sometimes we are psychologically and emotionally entangled to some person, and suddenly when we lose those person, we definitely move to that. And even our social media, that is every time feeding you the negative feedbacks, negative information. Just when I opened the morning, just I saw this is the suicide rate, rape case, the sexual abuse. So all the things are stained with the negative information. So we automatically feel depressed when we see other people are in stress or in depression. So that is the one main reason behind it.
Okay, sir. Does normal things such as eating habits or what you do generally in everyday life, does it affect your brain and does it cause clinical depression?
Definitely, it is a symptom. As you are suffering from some disease, so there should be some certain layer of symptom. But as it is your mental mind architecture is depressed, so but still as the mind and body work together, there is some certain signs and symptom, like you might have a excessive hyperphagia. You feel to eat much more amount, not just because of you having diabetes, but still some behavioral disorder, like you are changing your voice and pitch, hyperphagia, insomnia or oversleeping behavior. So sleep patterns, it has been studied that the part of the brain that is dealing with the circadian rhythm, sleep behavior, same part of the brain or similar part of the brain deal with the depression behavior. So it oscillates, as I told you, 2 weeks or more than 5 days or 7 days, it is continuously moving that orientation with a certain frequency. So that is the one criteria. Weight gain, suddenly you feel your body start, you have a body ache, pain in certain part of the neck region, any part of the body, abdomen. In case of female, you can see the possibility of having that one, irritability goes up. So you start fighting with the small issues, like with your mother or sister, they are start fighting and arguing. So what happens in that moment, your tendency will go from discussion to the kind of a mal conversation or argument. So wherever these things happen, you have to pay very much keen attention to those old people. Wherever you are seeing our discussion is not oriented towards a solution, rather we are going for argument and irritation level goes up. This is the indication that there is something going wrong with that person.
Okay, so this disorder, it is multifactorial or it is just a single gene?
No, it is definitely multifactorial because a different part of the brain encodes certain part of the brain. Like I must tell you, there is a scientist and he depicted one Brodmann brain mapping. So you can Google it, Brodmann brain mapping. They have mapped the brain to 44-45 regions. So you can see, if you take the human brain as the nut, so it is like this. You have a left and right hemisphere, and if you open up this nut, you can see different parts of the brain, like 44 and 45. It is with the Broca's region. So this part is activated, means the person is speaking. So if I destroy 44 and 45 in the Brodmann area, the capability to speak will be totally destroyed. Similarly, if you destroy the 17th area, so you cannot see. Similarly, if you destroy the amygdala and hippocampus to a certain extent, so it will be go like little bit in the surgical method. So I should not touch it. But Brodmann map says depression, spirituality, friendship, each and every inch of your behavior is always something to do with your brain structure. And another problem I feel ki our society is somewhat responsible for it. Our education system is also that much responsible, because now the international education system, if you go to the abroad and other country, like if you go to the England or take anything except India, we are orienting the brain towards the left hemisphere education system. So left brain means only your logical part. I can tell you some function of the brain that is to do with the left. Like they are saying logic, analysis, math, think in words. That is one of the major problem. I feel
our management, our education system is feather lighted. We are totally dumb and goofy to understand the problem of the student. Suppose a student is drinking water in the class or feeling sleepy, we behave in a negative manner, but we don't try to understand what is the thing that is going inside their mind. So, like another problem, that is the reason key in every minute students are committing suicide in India. We are thinking in words. So suppose you are in the examination hall, this is for the students, and suddenly you stuck and totally some information you are missing in the exam hall, but you cannot retrieve it because our left part of the brain is only active at that time, and we do not teach the student. That is the lag. Sex education and the psychology, these are the two major part of the human education system and human culture that we are missing. So now when we are not get connected with this right brain, so we cannot think in terms of image. It's always easier to remember the image than a tough word. What happens to that? Oh, I missed that word, I cannot remember the word, so I got a less marks. So now the student going in a loop of depression and feeling him or herself as a worthless. But that is the total flaw in the education system, where it is totally left brain oriented. So now the new models are, international models are coming. I don't know how much degree we can implement in India, but still we have a hope. So if you are orienting your right hemisphere is to do with your creativity, all types of your creative thinking, like holistic thinking, as we say. We always shouting about the holistic education, but we do not know how to implement it. So many models and ideas are there. See, this is the seed of depression, where we are implanting the things from our student life. Okay, fine. Now your intuition, your visualization. Now we are increasing only our mathematical and numerical skills and memory, but just activating the left hemisphere. So our plan should be like that. We should equally activate this 50-50%, so that we can take any problem in our life. It's a depression or your career in an unbiased manner. So that is the main reason. Another point is that we still do not know what is mind. We don't know the definition of mind and what is the nature of consciousness. We define mind as like you have some mental capabilities when your neurons or nerve cells are somehow express your consciousness, correct? Like you have a consciousness, even a bacteria have a consciousness, but it doesn't have a mind in that sense. They doesn't have a self-consciousness, correct? So when your consciousness interact with your nerves in a certain way, and it is expressing through your like a level of thought. So when you have a series of thought, it is like you are taking steps and walking. So it is a thought and thinking. Steps means you have a thought, and when the nerve cell interact with each other, you have a thought. But when you are thinking in a certain way, it is a thinking. So whenever you have lots of information, another major problem is that we are filled with information, and we do not orient those things in a correct way. So now there is a nervous breakdown or this kind of thing. So we have to plan a very good education system where we have to educate the mass and student from the beginning, and how to deal with this psychological turmoil in future.
Okay, so what may be or what are the physical symptoms of this clinical depression?
That is the weight loss or gain, insomnia, irritability goes up. You are feeling that you are discontent, you are stupid, you have done nothing for the society or something like that, anything. But it happens to some great people also. Once Swami Vivekananda, he also felt that I am suffering from a divine discontent, so I must die. So this, even Leonardo da Vinci, if you go for a great people, they also have suffered from those things. This is only because the society is responsible for it, because we do not know how to deal with those kind of people. That is why they create a personal group and gathering. Each and every person belongs to a certain community. So we have to go for a certain group of people of a same mindedness, where we can work together, we can talk. Talk is a therapy. So talk therapy is very important. Most cases we are surrounded by negative environment and negative people, that they cannot understand our feelings, our level of thought. That is the most major problem in the conflict. See, conflict begins from the home, okay? And school, college, everywhere if you go, most of the depressed person, they are under a certain state where the either financial condition is not good at home, or the relationship between the student and the parents are not good, and there is nobody to guide him or her. That is the major problem, and you are it is as you sow, so you reap. So as you sow the seed, the seeds will propagate, and it creates a proliferation, and it grows a cancer in the mind, and later we commit suicide and so many negative tendencies This is not a fact of one day or 1 week or 1 month. It is happening from the beginning. It is like that you are training a fish how to climb a tree.
So since we have shooted last video about psychological depression, what is the difference between the psychological depression and the clinical depression?
Very, very subtle, very fine. If your orientation, as I said, if your thought orientation creating a loop, if it is going in this way, so like a graph going up, that is thinking. But if it is creating a loop and if it is pushing you towards a negative behavior, correct? So there is a one strategy in the psychology. One, either you cope up in a positive way or you cope up in the negative way. Suppose you get addicted with something, you have a repeated behavior, you are addicted to some drugs, alcohol, even in the friend circle, video game, anything that is not proliferating your intellect. So that is the one strategy, as I said last video. Either you will go proceed or you have to retract yourself in terms of evolution. That is the one thing, and that is the one reason it has been estimated in future the suicide rate will go up 1 per 20 seconds. Now it is 1 per 40 seconds. It will go up. That is why we have to. It is a matter of grave constant. So we have to be very much aware, and we have to change our education system, our society, our most important, our family environment. That has to be checked.
And why is it that only tryptophan and lithium-rich salt, those things when we use in our diet,
Okay.
helps us overcome this clinical depression?
Okay, you have read about this thing. That is also true. Then you will go for a little bit of chemical basis of like dopaminergic neurons, and they say dopamine, serotonin, and tryptophan. So not tryptophan, that chemical is a dopamine and not epinephrine, but the precursor molecule is a tryptophan. Tryptophan is nothing but the amino acid. For the common listener, tryptophan is a very essential amino acid. Like you have heard about valine tryptophan, so it is encoded by the UGG code or whatever. Some food like fish, chicken, some nuts, so they are very rich in tryptophan. Now if that is a diet part, and a dietitian can guide you better, but still if you are suffering from tryptophan deficiency, you are prone to have deficiency in those chemicals. Like it is like a loop. It is told that serotonin, your dopamine, and norepinephrine. So it is something to do with the sequence of the behavior, like your motivation, attention, and pleasure. So suppose you are paying attention to some words, so serotonin is playing role. Now pleasure, dopamine, and attention, you have a norepinephrine. So this is the sequence. One chemical influences the other thing. But I don't believe in these things because there are so many people in the Himalayas and the Jogi. They normally deprived of so many nutrients. They are not even eating like after 7 weeks or even after months they are eating something, correct? So food deficiency is important, but the more important thing is that how you are dealing with this your mind and this kind of behavior. We discuss it in this way. There is so many confusion out of it, because when some doctors say serotonin, dopamine, and that one norepinephrine, this is produced, so now your behavior triggered, like your you can say your attention, correct? So now your pleasure. But again, if you put some attention and motivation, is it possible that behavior could trigger these chemicals? Then who is responsible for it? Chemicals are triggering your emotions, or emotions are triggering your chemicals? That is a controversial thing. And there are so many people, those can control and understand that this is all the shadow and the game that is happening at the mind level. So we can retrieve out of it. So I am not the body and I am not the mind. You just observe these things, how the things are happening. Suppose you are looking at the chocolate ice cream. Suddenly you get put attention on it, and you just motivated to eat those things, and you just enjoy it. But the same thing happens when you are depressed. You chocolate ice cream, even a beautiful thing that has that was previously capable to drag your attention, now you are filled with a boredom. So external object actually has no influence on the mind. It cannot trigger your chemical. This is how you respond to it. Because one song that is creating pleasure in your mind, but when you are depressed, you are annoyed by that song. It is possible. So you start thinking the lyrics and you try to find some meaning out of it, but you are not enjoying the song as you are enjoying when in the state of a joyfulness. So that is the one reason. That is why song is called a kind of a drugs.
Okay, so what are the drugs which can help us to overcome this clinical?
For that, I should not comment. Even I don't know because I am not a doctor. But there are some foods that we can take. L-dopa-rich foods we can take. Tryptophan-rich foods are there, and some drugs are also there that is create the neurological imbalance. Like some antibiotics are there, some analgesic ibuprofens are there. So those things has to be tested by the scientist, and those medications should be banned because the medicine that we are taking putting a huge neurological and physical imbalance in our system, and brain is also affected by those drugs where the blood-brain barrier is there, but some drugs can cross this system, so it can create a long-term effect. So medication, whatever we are taking for fever, for stomach pain, as an antiviral, anything, even the antiviral drug azidovitin that we have studied in the class also, that also creates some kind of a AZT that can something to do with the neurological imbalance or psychological imbalance.
Is there a particular age group like teenage or after from 20 to 30? Is there any particular age group which gets affected with this clinical depression?
Yes, it was there initially. The rate of committing suicide or having depression was for the old age people. Now they have created a society and we are supporting them. The rate is going to be increased. I think it will be within the age of 20 to 40. Because what happens, this is also very interesting question. Like your brain working in certain way, but this brain is neuroplastic. So change is always there. So the rate of change in between 20 to 40 is higher than the rate of change between 60 to 80. So 60 aged people, you cannot change them. Like you cannot change your parents, correct? So and even they cannot cope up with this new system of AI, correct? So but the rate of change that we are teenage to the 40, there is a huge neurochemical changes. Even I can recommend one very famous spiritualist, Eckhart Tolle. He has one international bestseller book, The Power of Now. He was trying to commit suicide at the age of 29 because he was totally depressed. It is nothing to do with the society. His brain was looking for something, and it is like this, we say in this way, a spider is making a web and he itself entangled itself in the web. So we are creating a wave of thought and we are entangling ourselves just by making some nonsense thought. So now that is the time. Einstein once told, if you are stuck in some state of a problem, you have to overcome it. It means you have to change the state of your consciousness. The problem that is being created by the one state of your consciousness cannot be solved by the same state of consciousness. I am saying this way. Suppose you are dreaming and you are chased by a tiger. So you are a certain state of consciousness, correct? So now by staying at the same state of consciousness, you cannot solve the problem. You change the state means you just wake up. So in the dream, you have some problem. Now dreamings, like sleeplessness, awakenness, like a highly motivated state you have there. So when you change the state of your brain, your problem is resolved. So when you open your eyes, when you wake up, when you enjoy the nature, no tiger is there. So it was in your dream. So one state of consciousness was actually get affected by some loop of thought. So that is the reason Einstein told, and he has a great experience, not just physics, also the mind. So you have to just change the level of your consciousness.
Okay, so to end up the video, I'd like to ask you that is there anything else which you would like to add?
Yes, you have some test like mini mental state examination. We can do for the society. Mini mental state examination, you can search it and you will get a piece of paper, and you just go for it from school, colleges, and you go for the test. It's like an IQ test paper. Now you allow the student to perform that test. Now if they're scoring very poor, that means those should be under the kind attention. Another thing I want to share with you, I have some drawing with me. So therapy part is there. Now if I show you some of my drawing, I recommend you just you draw this figure and you keep this figure to draw. Those are like suffering from, you are feeling that he is suffering from a depression. Now I have seen this one, like you are drawing a face of a Buddha. So if a person is serene and cool, you can see the expression is also reflected in the figure. But those are in the panic or in the state of a depression, they are drawing these things a different way. You can see a kind of a stress and fold in the figure. So this is called the art therapy. Now if I change the state of my mind when I was depressed, little bit, not clinically, so I start drawing this one. So each and every state of your depression or your consciousness, your response towards the environment will differ. Now in the art therapy, you can see the patterns they are drawing that is totally different from the common people. Even if they are writing something, they are changing their sequence of writing. Their pressure is very important. Even a teacher, we can study the graphology, handwriting analysis and the pressure gradient. So that is the reason we have to understand the students, and that is why B.Ed courses are there to understand their mind. So if we can create an environment, they can learn and they can solve any problem out of their life, not just depression. Another evidences are there, like one patient was told to draw one cat. So he was drawing a flower vase looking like a cat, and the eyes were like a burning. So he always exaggerate and makes the thing horrible. If something is simple, but their mind depict the thing in a horrible manner. So by like this therapy, we can understand how the patients are improving. That is the sign. After the medication therapy, the patient, when they are recovering, they are drawing the things in a better way. So that is how the doctor actually understand whether these patients are recovering out of it or not. And so many things are there, but you want to ask something?
No. Okay. So thank you so much, sir, for joining with us for one more video. Before ending the video, I'd like to say that subscribe to sir's channel, The Brain Buffer Biology, and we have many plans of making different videos on different topics such as even sex education or education system in India. So if you want us to make such videos, make sure to comment in the comment section and subscribe my channel. And many things.
So many things we have missed. I just want to say one thing. You want just stay with the positive people. Keep your environment proper. Make a friend circle with always optimistic people. Your mind is like a pen and a marker. You are writing something, and your mind is always ready to highlight something. So you are writing something in a certain way, but if you are highlighting your past mistakes and past faults, and you suffering from guilty conscience, your brain will definitely go to that region of clinical depression. So keep writing, don't highlight the past mistake. You have a pen, you have a whole future, and you have given unlimited sheets. So you can write so many things. You need not to highlight anything and go backwards to your life. There are so many choices, so many opportunities. Everything is a part of experience. Even Edison who discovered the light, yes, so he failed thousands of times, and he said, I didn't fail thousands of times, I discovered thousands of ways that doesn't work. Definitely depression is a problem, but depression have some positive effect that we have discussed in the previous video. So I feel you should stay with those positive minded people, and we have to, as a society, we have to take huge responsibility and care from the student level, because their mind is actually taking shape from that level of time. So that is the main reason we are not getting those education. So we have to talk about it as an education system in future videos. Thank you so much.
Thank you.